Hello, this is Sue, and today I'm with Dr. Hawass, and we're going to discuss some of his expert opinion on arthritis. So Dr. Hawass, can you tell us what's the current patient journey?
Yeah, so this is an interesting journey for patients. This starts with early arthritis, and that's when they experience some pain after a long physical activity, 45 minutes to an hour walk or a jog. At this phase, usually patients are in denial and think, I'm going to take some Advil, some Tylenol, anti-inflammatory medication, and things will settle down. But that's the beginning of the arthritis. As things progresses over time, and that speed of progression will be varies depending on the patient habitus, how much they weigh, what kind of food they eat, are they stressed out, do they sleep well, and that's when it progresses to mild arthritis. In the mild arthritis, it will be more consistent that every time you do a physical activity, you feel the pain in your joints. And usually people revert to going to their doctors to get either anti-inflammatory medication or a painkiller or a cream that can be rubbed on that joint. They can use some home remedies and so forth. And as this progresses a little bit further, that's when they move into the moderate arthritis, and moderate arthritis when you start having pain at minimal activities around the house. Generally speaking, the same amount of medication will be prescribed. If not, they increase the dosages of those anti-inflammatory or painkillers, a combination of both. At those point in time, generally the patient will be referred to an orthopedic surgeon, where they might suggest to get a steroid injection in the joint. Steroid injection might be helpful for a couple of weeks up to a couple of months. Long-term side effects of it is not really desirable. It just helps the pain for a short period of time, yet it kind of degrades that cartilage in the joint. So it kind of eventually they're going to end up needing a knee replacement surgery. Between the mild to moderate arthritis is usually the zone that I feel that most patients get stuck on. That's when they see the surgeon. The surgeon identify they do have an arthritis in the joint, and they tell them, yeah, you need a knee replacement or a hip replacement, basically a joint replacement of some sort. But however, you have to wait 5 to 7 years, if not more, before you get to the severe arthritis, before you qualify for surgery. So the biggest question that I ask for people is, what do you do for those 7 years? You lose quality of life. You're going to increase your anti-inflammatory medication. It's going to cause you more side effects from skin irritation, stomach bleed. You can increase the painkiller, which is, we're talking about pandemic of being on narcotics all the time. It's going to make you drowsy, groggy, constipation, lack of function. You can't focus that well. So this is really a lost life of most of the patients that are awaiting surgery. Once they hit the severe arthritis, which is they have chronic pain or pain manifestation even at rest or during sleep, that's when usually the surgeon will intervene by doing a knee replacement or a joint replacement in general. So yeah, it's a long journey. It might take between 15 to 20 years. This is my experience with the journey of patients with arthritis.
Okay. Do you think there's a right time for the patient to seek treatment?
Once they get early arthritis, I would suggest when they have it on physical activity, I said that this is the right time to start physical therapy, change your lifestyle, change your habits, and that's what we do in this clinic, is trying to rechange all those early on to prevent the progression of arthritis. If you're going to wait till later phase, it's really hard to revert everything. You will not be cured, but you're going to have a better function, but you still have some degree of arthritis at some point in time. Hi, this is Mark from ArthritisVIP, Toronto's #1 provider for arthritis treatment. If you're tired of being in pain and looking for a non-surgical solution that has proven track record, then contact us at 647-540-4025 or visit us on the web, arthritisvip.com.